I had hit rock bottom completely.
I just got away from an abusive husband.
Every day's a struggle.
You know, I don't know what I'm going to do.
We see an individual as a road to recovery. And we know when we're starting this journey, we feel alone. We feel like we're lifeless. And so when your life begins, it starts at the beginning.
What makes this program different is that a whole community of Palm Beach County reacted to the opioid crisis that exploded on all of us.
So there's really been a misunderstanding of this disease, a lack of understanding that this is a life-threatening, lifelong disease. And we had this revolution in our thoughts back in 2017, and we began this pilot program. Because what we really needed, what was missing, was someone who was willing to treat these patients lifelong. Just like a primary care practice would treat you if you had high blood pressure, lifelong.
Like a lot of people, I became addicted to opioids because of prescription medication. And so though the addict gene was there, it just took that opioid to be prescribed to me.
We're very proud of Matthew. Matthew started with us in around maybe 2021. And since that time, he has really tackled his addiction.
Had never used needles before, was injecting fentanyl, was using methamphetamine, drinking a couple bottles of vodka a day.
This program absolutely functioned 100% on warm handoff from this addiction stabilization unit, who is just next door to us. That warm handoff connect them to the outpatient clinic where they learn a lot about chemistry of their brain.
And this place has saved my life. It's 100% saved my life. I know that for a fact because coming in here, they've given me all the support. They have given me the medication. And now I come here knowing that I can help save other people's lives, which is very gratifying in itself.
If I need to summarize this program in one word or one sentence, it would be that we are really trying to medicalize this illness because those patients can get better and do get better.
So it's not one particular medication that's going to help a patient towards recovery. It's part of the solution. So it's medication, it's therapy, it's a sense of community that they get when they participate in our group sessions.
Just the all-encompassing program, and there's nothing like it that I've ever seen. And that's just been such a tremendous help for me.
I can tell you early on I observed a patient who came half naked after prostituting herself on the street, but the patient didn't have shoes. And before the patient went to the cab, one of our employees took off her shoes and gave to the patient. A few years later, we actually heard back from that patient who is now in sustained recovery in her home state, and she actually established a non-profit organization that gives shoes to the homeless patients suffering from substance use disorder. This illness is impossible to treat, even if you deploy all evidence-based medicine tool, if you don't give this compassion.